So certainly these randomized controlled trials that we discussed, hopefully the ASPIRE study in the United States, ENRICH-AF in Canada and in other places, they might give us a little bit more information about using oral anticoagulants, direct oral anticoagulants after a brain bleed. But it might be a contribution. There are currently 3 studies run in Europe that compare left atrial appendage closure to direct oral anticoagulants in patients with atrial fibrillation who sustain a brain bleed. So these studies hopefully will end within the next couple of years, and we are going to see the results. We'll get more data from these. So ATTICUS was a study in cryptogenic ischemic stroke patients who had an embolic-looking ischemic stroke, and in whom atrial fibrillation and other pathologies were not found. So this study randomized such patients to either Apixaban versus aspirin. We just heard that this study was stopped because of futility, which means that the Data Safety Monitoring Board apparently decided that there was really no way this study would succeed in showing better results with Apixaban. We're going to hopefully see the manuscript, and I know that this study also included brain MRIs, so we will hopefully get quite a bit of information on that from a stroke prevention standpoint. The ARCADIA study run by Dr. Human Kamel and Mitch Elkind and others, it is looking at the, again, Apixaban as a direct oral anticoagulant in patients with cryptogenic embolic-looking ischemic strokes without other clear-cut underlying pathology, who have some cardiac imaging and EKG findings that might suggest a higher likelihood of atrial fibrillation. Again, this study compares Apixaban to aspirin. We're going to get some information from that, hopefully within the next 2-3 years. This should be coming up. Otherwise, yeah, there are a lot of efforts going on in better understanding our current failures in atrial fibrillation. The neuro-AFib study that I'm leading will give us a lot more information why we are failing so often, why we are still having close to 180,000 patients who come in with strokes and atrial fibrillation. We will need to do a lot more work on both detection of atrial fibrillation and better treatment of atrial fibrillation to prevent more of these strokes. These are some. There are definitely more, and there are definitely more studies in the acute treatment aspect as well, but these are a couple of them that hopefully we might be seeing the results at meetings like that and in scientific journals in the next few years.